Hi everyone. We are group one. We will be presenting on diabetes mellitus, type 1 and 2. My name is Celeste.
Hi everyone, my name is Lee.
Hi there, my name is Cynthia Nuccio.
And I am Stephanie Orozco.
So, what is diabetes mellitus? It is a metabolic condition which inhibits the body's production of insulin or the body is unable to respond to insulin. We are going to discuss the etiology and risk factors of diabetes mellitus, but before we do, we have to differentiate between the types. In this PowerPoint, we are mainly focusing on type 1 and 2. In type 1 diabetes, there are two subcategories, which are idiopathic and autoimmune. Type 1 idiopathic diabetes essentially has the same effects of type 1 autoimmune, except there is no evidence of the cause. In other words, there is no evidence of the beta cell autoimmunity. With type 1 autoimmune, this is an autoimmune disease that damages or destroys the beta cells in the pancreas, thus leading to insulin deficiency or no insulin secretion at all, and resulting in hyperglycemia, which is high blood sugar. Moving on to type 2 diabetes, this is the type many of us are more familiar with. This is a progressive metabolic disease in which there is a deficit or there's a defect in beta cell function, leading to an increase of insulin resistance and a decrease of insulin production. A key point to remember is type 1 diabetes is an autoimmune disease, while type 2 diabetes is a metabolic disease. Moving on to etiology and risk factors, with type 1, this type of diabetes cannot be prevented because it is passed through genetics. Again, with type 1 idiopathic diabetes, the cause is unknown, but it is shared through genetics. However, for type 1 autoimmune diabetes, you would have the gene for it, and it is activated or triggered through either viral infections, certain drugs, or food. With type 2 diabetes, the risk of it can be reduced, which we will discuss later on. Type 2 diabetes is acquired in combination of genetic and environmental factors. Some risk factors may include family history, age, obesity, hypertension, poor diet, and physical inactivity. Now going into incidence and prevalence. According to the CDC, as of 2022, 11.33% of the US population has diabetes. To break down that percentage, the 11.33% translate to about 37.3 million people have diabetes, and this includes people that are diagnosed and undiagnosed. There are 28.7 million people that are diagnosed with diabetes, and the CDC estimated about 8.5 million people that are undiagnosed with diabetes, which when adds up, it estimates to 37.3 million people. This graph here presents a visual of the increase of diabetic people that are 18 years and older from 2001 up to 2020, and it does entail the total diabetic people diagnosed and undiagnosed. This bar graph here presents the race or ethnicity for both men and women who has been diagnosed with diabetes. According to CDC in 2022, American Indian and Alaskan Natives are presented at 14.5%, followed by non-Hispanic Black people at 12.1%, people of Hispanic origin at 11.8%, non-Hispanic Asian people at 9.5%, and non-Hispanic white people at 7.4%. And as you can see, there is a trend in diabetes with ethnicity and races as well, which could be due to cultural and environmental factors. This is a map here that shows the increase of people living with diabetes from 2004 to 2019. According to CDC, people with diagnosed diabetes has increased from 6.3% in 2004 to 8.4% in 2019. Now we're going to be discussing the differential diagnosis.
Thank you, Celeste. In regards to differential diagnosis, there are multiple ways that different conditions can mimic signs and symptoms the same as diabetes. One of them being corticosteroids, which are a common treatment for various arthritic problems and needs to be given carefully as steroids reduce the sensitivity to insulin and requires more insulin to transport glucose into cells. Cushing's syndrome produces excess cortisol and fails to regulate blood glucose elevating levels of glucose in the body. And during an infection, the body is trying to overcome a pathogen, which increases the amount of glucose circulating in the body as well. Another potential cause of also mimicking the same symptoms as diabetes is damage to the pancreas, such as pancreatitis, which causes structural and functional loss of the islet cell mass, which causes loss of insulin, glucagon, and pancreatic polypeptides, making it difficult to control glucose levels, as seen in the next figure, 19.5, which shows the visual of where the location of the exocrine glandular cells around the small pancreatic ducts is located. The next topic is pathophysiology.
Okay, and type 1 diabetes, it usually results from autoimmune destruction of beta cells of the endocrine pancreas. The pathogenesis of type 1 diabetes, the most important factor to note is that it's genetic, and some factors to consider are the environmental and autoimmunity factor. Type 1 diabetes has a possible linkage to a virus called human enterovirus, HEVs. HEV is a large family of viruses that enter the gut and spread through poor hygiene or sanitation. In type 2 diabetes, our pathophysiology focuses on the issue that the pancreas makes less insulin and your body becomes resistant to insulin. It is one of the most common metabolic disorders caused by a combination of two primary factors, genetics and lifestyle.
In this diagram, we see how a healthy pancreas releases insulin, binds to the insulin receptor on a cell, and allows glucose to enter the cell. In type 1 diabetes, unfortunately, there is no insulin being produced, so there is no way that the insulin can bind to a receptor and allow glucose to enter the cell. And in type 2, the pancreas is producing insulin, but there is a faulty receptor in which the insulin is being released by the pancreas, but in the case the cell fails to respond to the insulin properly, that prevents the body from reducing blood glucose levels effectively. And the
Next section is signs and symptoms. The onset of type 1 diabetes usually occurs in patients under 30 years of age. The onset of type 2 diabetes is normally found in obese patients over 30 years of age with a familial history of diabetes, but we are seeing more and more cases of obese children developing the disease as well. Types 1 and 2 diabetes have many similar signs and symptoms. Polydipsia, or increased thirst, is due to intracellular dehydration. Polyuria, or increased urine output, is due to the diuretic results of hyperglycemia. Polyphagia, increased hunger, is due to the depletion of nutrients in the body. Fatigue from metabolic changes in the body. Frequent infections caused by increased glucose levels, supporting the growth of microorganisms. Extended time for wound healing due to circulation being affected. Genital itching in female patients due to fungal growth encouraged by glycosuria and hyperglycemia. Blurred vision due to water in the eyes being affected by glucose levels. Paresthesias, tingling, pain, numbness, or burning in hands and feet, and chest pain from plaque accumulation. Type 1 diabetes also has a few more signs just specific to type 1. Weight loss due to fluid loss and nutrients used for energy, nausea or vomiting, and abdominal pain from diabetic ketoacidosis. Our next section is diagnostic tests and labs. If your doctor suspects that you may have diabetes, they will order tests to confirm their diagnosis. Here are a list of a few of the tests they may order. Hemoglobin A1C test measures the average blood sugar over the last few months. A1C level above 6.5% would indicate diabetes. A glucose tolerance test measures your blood sugar while fasting and then measured it again after drinking a glucose-filled beverage. A blood sugar level of over 200 milligrams per deciliter indicates diabetes. Fasting blood sugar test measures your blood sugar after fasting overnight. A blood sugar level of over 126 milligrams per deciliter would indicate diabetes. A random blood sugar test would measure your blood sugar without any fasting or preparation for the test. A blood sugar level of over 200 milligrams per deciliter would indicate diabetes. There are also urinalysis for ketones that can be used to identify type 1 diabetes, and islet autoantibodies blood tests can be used to identify type 1 diabetes. Our next section is on treatments. Treatments for type 1 and 2 diabetes are generally the same. It should be from a holistic standpoint and include diet, exercise, and consistent use of your medication. Currently, there's no cure for diabetes. While it is possible for type 2 diabetes to go into remission through weight loss and keeping blood glucose levels stable, medication is a daily necessity for those who are unable to do so. There are three main types of diabetes medications: insulin, oral antidiabetics, and non-insulin injectable medications. Commercially available insulin was designed to replicate how the pancreas releases insulin naturally throughout the day, called basal insulin, and also after carbohydrate consumption, which is called prandial insulin. Insulin is characterized by the length of its therapeutic effect. These include rapid, short, intermediate, long, and ultra-long acting insulin. Rapid, short, and intermediate acting insulin are taken before a meal to help manage the rise in glucose after eating. Intermediate acting insulin can also be taken before bedtime in order to maintain blood glucose levels while sleeping. Long-acting and ultra-long-acting insulin maintain basal blood glucose levels for 24 hours and beyond. Insulin can be administered via inhalation, an insulin pump, or subcutaneous injections in the abdomen, thigh, or upper arms. Sites for injection should be rotated to avoid lipohypertrophy. Oral antidiabetics can be used alongside diet and exercise by those diagnosed with type 2 diabetes. These various medications can reduce the production of glucose by the liver, stimulate the release of insulin from the pancreas, block reabsorption of glucose by the kidneys, or slow carbohydrate absorption by the intestines. Non-insulin injectable medications include incretin and amylin mimetics. Incretin mimetics decrease glucagon secretion, which then triggers the release of insulin. Amylin mimetics are used in conjunction with insulin and help reduce glucagon secretion.
Okay, going into nutrition, it is important to note that there is no quote unquote diabetic diet, which is a misconception amongst many, that people living with diabetes cannot enjoy regular food. That is not the case. People living with diabetes can enjoy quote unquote regular food, but with more consideration as to what they are eating. Diets should be individualized. In other words, a diet will vary depending on each individual. It depends on their lifestyle and their dietitian's recommendation. However, some guidance to follow would be to avoid simple carbohydrates, saturated fats, and red meat, and instead replace them with fruits, vegetables, fibers, and nuts. Continuing, a nutritious diet for diabetic patients would include a high fiber diet, about 14 grams of fiber for every 1,000 calories. Some high in fiber foods are beans, vegetables, and whole grains. Having a low intake of saturated fats and trans fat and replacing it with something like fish, which has polyunsaturated fatty acids. Maintaining a low cholesterol. If recommended, people could begin carbohydrate counting to limit the amount of carbohydrates they intake and at which speed. Eating protein like meat, eggs, and fish. Lastly, limit their sodium intake to about 2,300 milligrams per day. But again, every person's diet differs from the next and should be arranged in cooperation with their dietitian. It is also recommended to eliminate tobacco use and limit alcohol use. Next, we will discuss the physical activity portion of the treatment. The benefits are as follows. Diabetic people would be able to maintain a healthy weight or lose weight if advised by their doctor. Their sleep quality could improve. They could control their high blood pressure. Physical activity could make their body more sensitive to insulin, thus breaking down the glucose. and physical activity can lower risk of cardiac disease, one of the major concerns for people living with diabetes. Of course, with each person, their physical activity tolerance differs, and others may tire more easily or may lack motivation. But some activities to start with can include walking, dancing, swimming, bicycling, sports they enjoy, or even performing housework. Next is prognosis.
Thank you, Celeste. Having high sugar levels in the blood for a long time, in the body for a long time, can damage both small and large blood vessels, which is why management of the disease is important to avoid damaging systems and organs such as the nerves, eyes, heart, kidneys, and liver. Diabetes is the leading cause of kidney disease. It is present in about 1 out of 3 adults with diabetes. End-stage kidney disease is 10 times higher in people with diabetes. Non-alcoholic liver disease is present in 50% of diabetic patients. Atherosclerosis, hypertension, and increased risk of stroke can also be present in patients with diabetes. On the next slide, we will see a visual representation of what diabetic retinopathy looks like. It is another condition that can develop. It is a progressive damage to the retina due to prolonged high sugar levels in the blood. It usually affects both retina and the eyes, which occurs when tiny blood vessels leak blood and other fluids into the macula, where clear vision occurs in the retina. Swelling of macula results in blurred vision, and if left untreated, can cause blindness due to damage to the optic nerve. Did you know that 1.84 million people have vision-threatening diabetic retinopathy? It is divided into two stages. The advanced stage is due to poor oxygen supply to the retina and formation of unstable blood vessels, causing clouding vision. Prevention or slow development of diabetic retinopathy is encouraged, given treatment outcome varies. Diabetic polyneuropathy is also in patients who are at risk for injury due to inability to perceive pain that can cause further nerve damage if left untreated. It is also the primary cause for amputations. The next slide is nursing care plan.
For our nursing care plan in type 1, we need to note that it is an acute and signs are usually more visible and it is a chronic condition. We always include instructions for insulin dosage and management. In our assessment, typical subjective data that the patient reports is polydipsia, polyuria, and polyphagia. An antibody test is usually used to check for certain autoantibodies and is used to differentiate between type 1 and type 2 because in type 2 the autoantibodies are not found. Another important assessment we find in our nursing care plan is the risk for impaired skin integrity related to slow healing process and decreased circulation. Typical goals in our care plan include daily blood glucose monitoring and have a blood glucose level less than 180 milligrams per deciliter, fasting blood glucose levels of less than 140 milligrams per deciliter, and hemoglobin A1C levels less than 7%. It is important to monitor blood and urine for the presence of glucose and ketones. Also, teaching the importance of an adequate diet with proper meal times and adequate calorie intake should be important for when evaluating our patient for type 1 diabetes. In type 2, our care plan should note that the disease is gradual and related to lifestyle choices and factors. Therefore, it is possible for a person to go into remission without using glucose lowering meds. An important symptom when assessing the patient is the darkening of skin patches around the armpits and neck. This symptom is usually frequently associated with insulin resistance, and it is important for the patient to maintain a balanced nutrition to meet the daily body requirements of calorie and nutrient needs. An important planning goal for the patient is to try to at least get some exercise done throughout the day to reduce complications of type 2 diabetes. Also, monitoring blood glucose levels is another central aspect when planning the care plan. It is important to let the patient know when to monitor their blood glucose levels and to remind them to eat and take their medication at proper times. Providing pamphlets and infomercial is important for the patient when evaluating his understanding of the disease and how they should notice how to live with the disease and accept their condition. Additionally, since it's mostly a lifestyle change, we need to note that um, exercising more often and eating a well-balanced diet could lead to a possible remission of the disease.
Okay, so that's it for our presentation on type 1 and type 2 diabetes mellitus. These are our resources here. And that's it. Thank you.